Hello everyone, myself Dr. Ashkarali. I'm an ENT specialist working in NMC Medical Center Al Majaz, Sharjah. I have more than 10 years of experience as ENT specialist. My area of interest is in pediatric ENT, ear disorders and speech and voice disorders. As you all know, ENT is a branch of medicine and it is dealing with ear, nose and throat disorders. Today we will be discussing about the most common ENT diseases in pediatric population. It is very important to know the common disorders that is affecting our children. So we can start with the nose itself. Most of our children, they will be suffering from nasal obstruction, nasal congestion and frequent nasal discharge. So we have to find out what is the exact cause behind it, because that is just sign and symptoms of any underlying diseases. And when it comes to the ear, same hearing loss, ear discharge and some kind of frequent ear irritation in children. So we have to find out what is the exact cause behind it. And when it comes to the throat, it is same like any voice changes, any difficulty in swallowing or any kind of frequent throat infection. So these all things are related to each other. When it comes to the adenoid, it is very important to know, because that is very common disorder in our children, because it is, as you know, adenoid is a tissue, it is just obstructing the nasal pathway. So normally, as we know, when we breathe, the air goes through our nose and it purifies everything and it goes to the lungs. So if there is an obstruction in the nose, definitely the children will start from mouth breathing will start. So once they started mouth breathing, so every infection, it is very easy for them to get any kind of respiratory infection. So the adenoid can lead to any other problem related to ENT, including throat, ear and the snoring. Everything can be due to the adenoid. So understanding and treating the adenoid issues are the best way to avoid these all ENT related conditions. So when it comes to the ear, actually, frequently we have seen the ear discharge and most of the children having hearing loss and a frequent ear irritation. So it can be due to multiple reasons, including, as I told in the previously, adenoid issue can be possible, maybe due to there is a tube connecting from the nose to the ear. It's called eustachian tube. Any kind of eustachian tube dysfunction can lead to the ear disorder, and if we are not treating the ear diseases perfectly or properly, maybe it will lead to chronic ear disorders like CSOM, and there can be some perforation in the eardrum. So treating as early as possible is the best way to avoid those kind of chronic diseases in the ear. As we know that children, it is the age of learning. So most of the time, children, when they hear better, they learn better. So there is no disease, there is no nasal irritation, there is no nasal obstruction. So it is easy for them to learn by hearing and not having any kind of nasal discharge or those kind of time. And frequent respiratory infection and frequent infection may lead them to absent from the classes and all. So it is very important for them to hear better and learn better. So the learning is directly involved in the hearing and most of the ENT disorders. So avoiding the ENT problems can lead to a better learning. So as I told earlier, because of mouth breathing, as you know, when we breathe through the nose, everything will be purified and goes. Once started breathing through the mouth, that is very frequent contact with the pathogen and all the infections. So it is very common for children having throat infection, maybe due to the mouth breathing. And as you know, the tonsil is also very frequent. Most of the time, the tonsil will be enlarged, and frequent contact with the pathogens maybe lead to the throat infection and can lead to frequent throat pain and sometimes difficulty in swallowing and all. So understanding exact cause of the throat disorder and treating it is better as early as possible. So the other most common problem that parents complaining about the children is snoring. So as we know how the snoring comes, right? So it is almost when the air goes through a narrow place, then definitely that snoring comes. So you can just imagine from the nose to the lungs. When we breathe, it starts from the nose, then it goes to the throat, then it goes to the lungs. So in anywhere, if there is a narrowing, then definitely that snoring, the sound comes, the sound vibration, it comes out. So we have to find out exact cause, and it can be from the nose, it can be from the throat, and it can be even from the lungs. So we have to find out what. Normally in children we can see in the snoring, it's mostly due to the adenoid issue and throat tonsil enlargement and all. So it's better to evaluate and find out exact cause and treat it as early as possible. Here is my take-home message to all the parents having wonderful children. So most of the time, you just examine if there is any nasal discharge or nasal obstruction, children is complaining, and ear discharge or frequent ear irritation, and they are complaining about throat irritation or something. Just to examine properly, and if you see any abnormality, because it is very common to have our children, they will put some foreign bodies or anything in the nose and all. So just examine. If you feel any abnormality, you just take them to ENT doctor, and that is the best way to manage, and we can avoid all the possible complication arising from the ENT disorders. I hope I have answered most of your doubts about pediatric ENT disorders. If you want to know more or consult with me, I am Dr. Ashkarali, ENT specialist working at NMC Medical Center, Majaz, Sharjah.